United States European Union statistics on common diseases in the elderly in the US and Europe and how to prevent them. The following data is summarized from WHO, CDC, US, and the European Center for Disease Prevention and Control, ECDC. Statistics on common diseases in the elderly, US and Europe. 1. Hypertension. US, 70% of adults aged 65 plus. Europe, 60 to 75% of older adults, depending on the country. Common causes: arterial stiffness, high sodium diet, obesity, stress. 2. Cardiovascular diseases. US, leading cause of death among older adults. 25 to 30% of people aged 65 plus have coronary heart disease. Europe, responsible for 40% of deaths in the 65 plus population. Includes heart failure, myocardial infarction, atherosclerosis. 3. Type 2 diabetes. US, 27% of adults aged 65 plus. Europe, 20 to 25% of older adults. Often related to excess weight, lack of exercise, and high sugar diets. 4. Arthritis and degenerative joint diseases. US, 49% of seniors suffer from arthritis or osteoarthritis. Europe, 30 to 50%, depending on the country. Commonly affects knees, hips, and spine. 5. Cognitive decline, Alzheimer's, and dementia. US, 11% of adults aged 65 plus have Alzheimer's disease. Europe, 7 to 10% of older adults. Rates increase sharply with age. 1 in 3 people over 85 has cognitive impairment. 6. Osteoporosis. US, 25% of women aged 65 plus. Europe, 20 to 30% of older women and 6% of older men. Leads to a higher risk of hip and spine fractures. 7. Chronic obstructive pulmonary disease, COPD. US, 10% of adults aged 65 plus. Europe, 6 to 12%, especially high in Eastern Europe. Strongly linked to smoking and air pollution. 8. Depression and sleep disorders. US, 15 to 20% of seniors have depression. Europe, 20% of older adults experience anxiety or insomnia. Often underdiagnosed because symptoms may be mistaken for normal aging. 9. Cancer. US, 60% of cancer cases occur in people aged 65 plus. Europe, similar rate, 55–60%. Most common types: colorectal, lung, prostate, breast. 2. How to prevent diseases in the elderly. Applicable to both US and Europe. 1. Healthy diet. Reduce salt intake, 5g/day. Eat more vegetables, whole grains, fruits. Limit red meat and processed foods. Increase fish, nuts, and olive oil, Mediterranean diet. Avoid sugar and sugary drinks. Back-end index pointing right helps reduce risks of hypertension, diabetes, and heart disease. 2. Regular physical activity. Walk 30 minutes per day. Light cycling, swimming, yoga. Strength training to protect bones and joints. Back-end index pointing right lowers the risk of heart disease and diabetes by up to 30%. 3. Regular health checkups. Blood pressure monitoring. Blood sugar tests. Lipid profile. Cancer screenings, colon, breast, prostate. Cognitive assessments, MMSE. Back-end index pointing right early detection greatly improves treatment outcomes. 4. Mental health care. Avoid chronic stress. Meditation, counseling. Regular social interaction. Back-end index pointing right helps prevent depression and dementia. 5. Adequate sleep, 7 to 8 hours per day. Improves memory, immune function, and blood pressure stability. 6. Quit smoking and reduce alcohol consumption. Reduces COPD and lung cancer risk by 50%. Lowers risk of stroke and heart attack. 7. Essential vitamins and minerals. Calcium plus vitamin D prevents osteoporosis. Omega-3 supports heart and brain health. Vitamin B12 supports nervous system function. 8. Fall prevention at home. Install handrails. Use anti-slip carpets. Ensure proper lighting. Backhand index pointing right, extremely important because fractures in older adults can be life-threatening. 3. Conclusion. The most common diseases in the elderly in the US and Europe include hypertension, cardiovascular diseases, diabetes, osteoarthritis, dementia, COPD, osteoporosis, cancer. However, up to 80% of age-related diseases can be prevented with balanced nutrition,